St. Mary's North in Knoxville, Tennessee was a new facility on a greenfield site. And they came to us and asked us to help them design a hospital that was based on safety for patients, and they wanted this to be really technologically advanced. The most important thing for them was that they wanted to create this safe environment for patients, and they really wanted to set some outcomes that they could achieve with this facility. At St. Mary's North, the types of technology that were incorporated included things like a tracking board that keeps track of the patient's supplies and equipment, a hands-free communication system that the staff, and physicians and nurses both wear, that allows them to be in contact with each other instantaneously. They have things like room service dietary, so the patient can order their food when they want it and order what type of food they want. They also have bedside admission, and a registrar would come and complete that registration in their private environment while their care was being considered at that time. Giving the patient control over their environment was another important step there, where from the bedside the patient can control the temperature of the room, when their blinds are open or closed, and their TV controls, as well as ordering what food they want when they want it. At St. Mary's North, there was a lot of new technology, and obviously there was all new staff there too who really didn't know the system and hadn't worked with that type of technology before. The administrators there, when they hired staff, just told them up front, if you're not interested in learning new technology or working in this kind of environment, this is not the place for you. And that really helped because they were able to attract staff who wanted to learn to work in that environment. Probably one of the hardest things administrators have to deal with is really to allow that staff to be inefficient for a period of time while they learn a new way of doing things. And there were a lot of new ways of doing things in this facility. So that normally takes about 6 months for people to be really comfortable to work in those kinds of environments. Some of the design interventions that we used at St. Mary's North that were really based on research and other studies that were going on at the time they were all private rooms. They were standardized, same-handed patient rooms. They included a large space for the family within the room with a sleeper sofa. One of their process changes was to allow families 24/7 visitation. That was new to them. They had to learn how to do that, and they did it even in the ICU. Giving the patients control over their environment really helped the patient, but it also saved time for the nurse or the caregiver who had to go in and answer a call light or to take care of one of these tasks when they could control that themselves. And then we also did what's called a pass-through patient server, where some of the medications for the day and a par level of supplies are kept right there within the patient room. And those can be supplied from the exterior hallways, so you're not interrupting the patient flow, and then the staff can actually access those cabinets from the inside of the patient's room, so it makes them more efficient and makes sure that the patient actually benefits from having everything close by. St. Mary's North has really been measuring some of their outcomes, and after about a year and a half, they've realized some good results, things like their patient falls are fewer than what's been set as a target for their system. Their patient satisfaction scores are in the 98th percentile for Press-Ganey. We actually shelled a lot of space when we were working on that project for future growth, and they've hit that growth and they've fitted out the space, so they're really looking to expand their campus. They're getting more patients and they're growing that way. And I think just overall, when you talk to staff, they love working in that decentralized environment. They probably wouldn't have said that on the first day they opened, but they realize everything they need to take care of their patients is right there at their fingertips.